All right, so what are we doing?
An extended tummy tuck.
An extended tummy tuck or an extended abdominoplasty, right?
Right.
Here at the Cosmetic Surgical Center of Cerrito, and this is a large abdominal panniculus, right, Gabby?
Right.
Hey, welcome back, Gabby. How you doing?
Good.
How's your life, Gabby? Taking care of your baby, yeah?
Yeah.
Incredible. So what we're gonna do is we're gonna go ahead and start with tumescent anesthesia, and now we're following it up with electrocautery, right? So we put plenty of tumescent anesthesia, and this is the way we do it. This is how we do it. Is that how we do it? This is how we do it. It's a movie, right, or a song, right? This is how we do it. Yeah. Thank you. Alrighty, so we want to welcome Misa here. Misa is a registered nurse, right, Misa? Why don't you tell us your story, Misa?
Oh, wow, thank you.
You were born in Manhattan, right?
I was born in Manhattan.
And you cried, and then what happened?
And then from there, I went on to nursing school,
Nursing
directly out
school.
of the NICU.
Wow, so you've done a lot. You're an operating room nurse?
Yes, sir, I am.
All right, and how many years of experience as an OR nurse you have?
I've had 19 years of experience.
19 years of experience?
I was originally trained at Cedars-Sinai Medical Center in Los Angeles, California.
Wow, yeah, I've been there.
Yes, sir.
Yeah, you know what, when I went there, I got in the elevator, you know who I ran into?
A movie star.
Johnny Carson.
See, I told you.
Yeah. Anyways, yeah, I ran into Johnny Carson right there.
Yes,
but
sir.
tell us the story. So you're an operating room nurse, and so I'm going to ask you a question. You've seen abdominoplasties like
Yes,
this?
sir.
Yeah, before?
Yes,
yeah.
sir.
So what do you see here? What is different about it? What do you see here compared to your 19 years of experience as a nurse? Do you see anything different?
I see somebody who is highly skilled and very precise with his excision here. Let's see.
Oh, so
very careful.
Be careful about what? How do you know I'm careful?
Because you are controlling your bleeders at an incredible rate here.
Controlling my bleeders, what?
At an incredible rate here.
Incredible rate.
Yes, sir.
Okay, can you talk about that?
Never saw this before done as eloquently and as professionally as this doctor is doing it.
So what impresses you is what?
Your skill level, sir.
But the skill level you see.
Yes, sir.
Because you say I'm skillful. Why? Because there is no what? What were you saying?
I was saying you haven't asked for a clamp not one time during this procedure.
So what are the clamps used for?
The clamps are used to control bleeding, sir, of small vessels.
Bleeding of small vessels. Is it a small vessel right there?
There it is, sir.
That look like a little sausage to me.
Yeah, it looks delicious.
Yeah, that's funny. Anyway, we're having a good time here.
Yes, we are.
So it's a bloodless field. That's what. And did we pay you to say that, or are you
No,
saying
sir.
that from the? Did
No,
we?
sir.
Did
No,
we
sir.
prep you?
No,
to say?
sir.
No, this is just your own observation.
On my
From
own.
19 years of experience.
Yes.
Well, thank you so very much.
You're welcome, sir. You're doing an excellent job.
Thank you. You too.
Thank you.
She's got a very, very long distance here, Gabby, right? From the belly button. Look at all these. She's got a long torso, and this is a lot of stuff we're gonna take out. Look at this. So the question is that a big deal, Gabby?
Yeah.
Yeah. Why is that a big deal?
It's hard when we reach up here.
Yeah. Wow. Why is that difficult?
Hard to retract.
Yeah, hard to retract. Yeah. And what about the belly button? Isn't it more difficult for her to keep her own belly button?
It is. Sometimes you have to do the down.
Yeah, because a big difference, but we didn't do it. We didn't do it on her case, yeah. So anyway, the concern here, you guys, is that the belly button may be too high, too high. It's very long. I mean, I would like to measure, actually. We can measure how long it is. It'd be interesting, to measure and see. But this is what we call the specimen. This is what we're dividing, right, Gabby?
Right.
It is incredible. But so far we have not, never really had to, with the grace of God, never had to
Keep the dome.
Yeah, no, we have to keep the dome. So a couple of times, yeah. But we have not done is we have never
And too
have
short.
to like amputate the belly button.
Oh.
We never have to cut it off and reposition it, right?
Right.
Or it's called floating in medicine, surgery. We call it floating of the belly button. We never have to do that, right?
Right.
So we always keep the patient's belly button. And don't worry about this. This is burn edge, but we're going to remove it later. So it doesn't have to be perfect. It can be, you know, like that, because we're gonna remove. So this is a number 10 blade. It's a very, very sharp knife. Yet, you know, when we go through this, you don't see any bleeding, right? This is just pretty incredible. And we're gonna follow this with electrocautery. So it's a special technique. Like Misa was saying, she's been a nurse for 19 years in the operating room, right? Very, yeah, and she's never seen anything like this, right, Misa? Is that right?
I'm not kidding.
I'm not putting
it like that.
I'm not putting words in your mouth. This is the truth.
It is absolutely true.
Yeah, pretty incredible, huh? And so of course, much less risk of anemia, right, Misa?
Yes.
Much less risk of blood transfusions or reoperation for surgery, right?
Yes.
Something that we never done. Incredible, right?
Yes,
It's hard to believe, but it is true. So if you would like to have a procedure like this, please give us a call, okay? 510-525-7999. Operators are standing by. Thank you. This piece, huh? Incredible. Look at that.
Huge.
Absolute big piece and absolutely bloodless. Look at all the stretch marks out. Thank you. So this is the right side now. Whoa, look at that. Incredible, huh? No bleeding at all the stretch marks gone. Thank you. Alrighty, so what are we doing?
Create a new home for the belly button.
A new home for the belly button is right, Silvita? Yeah, that's great, yeah. So we're doing deepithelialization of this area, which is not part of the abdominoplasty technique, but it's something that I decided to do because of a couple of things. One is, do you see any bleeding? Yeah, because the dermis is basically an avascular membrane of the skin, right? And so we do it, number one, so there is no bleeding. And number two, yeah, we do it to leave a little rim around the belly button. You see that white rim?
Yep.
Around the belly button. I leave that around the belly button so that it sort of protects me. It's like a barrier. It protects the skin from burning. And what are you doing, Sylvia?
I'm cooling the area.
You're cooling the area with room temperature normal saving, right?
Right.
So that the heat doesn't transmit. Because this is an electrical instrument. It can cause a burn. And you saw it in the inside when we did the belly button. In the inside, of course, we're going to take that burn edge out. But here in the outside, we don't want to do it because that would be permanent, right? But in the inside, we're going to also take that burn edge out. You got it? Now, this is a lot of stuff here that I have to go through, you know? So, you know, it's, I don't even know that it's going to, like, it may not even reach, you know? Look at that. I'm trying to put my finger in there, but this thing, the whole thing goes through and nothing comes out. Look at that. I'm trying to pull my finger out to here, but it is a lot. It's a lot of stuff. Look, it doesn't even come out, man. Wow, that's incredible. Thank you. Wow, man, look at that. The whole pen goes through. Oh, baby. Oh, there
There
we
it
go.
is.
My finger barely coming out of there. See? Hello. Can you see this bulge? You see that bulge in there? So that's intra-abdominal fat. That's fat that belongs inside. That's well inside the abdominal wall cavity. But notice how, and this is the belly button right there that's coming on top of it. But basically we did the rectus plication above, and now we're doing the below the belly button area. So why don't you move that belly button up so that they can see? There we go. So that's better. And but basically when we're done with this is a multiple figure of 8 sutures. When we're done with this, she's gonna be like that. She's still gonna have all that intra-abdominal fat. That's fat inside where the intestines are, but she's gonna be better. So these muscles separated. These are twin muscles that are joined in the middle, and they separated during pregnancy. So we're gonna restore her anatomy to pre-pregnancy state. Thank you. So this is antibiotic irrigation we do routinely. This is your belly button right here. We already cut the edge of the belly button, and she's not totally flat, but it's a lot better than she was. So she's very nice and tight with the rectus plication above, all the way up to the rectus, all the way up to the xiphoid process up here. We're covering a tattoo here, but it goes all the way up there. That's your belly button, and the outside, that's the opening where the belly button is gonna come out. So it's her own belly button, and we make it similar shape to the outside. It looks incredible. Thank you. Awesome, so we are done. Extended abdominoplasty, 0 liposuction. We're gonna do liposuction 6 months later, which I believe is safer, because we do liposuction at the same time. Yeah, of course it needs liposuction, but we can do liposuction at the same time. We're covering a tattoo over here. Then the abdominal wall can die. She can end up with a big hole here, necrotic, infected. It's a complication I don't wanna have. And I don't want my beloved patients to have that complication. So what we do an extended tummy tuck with 0 liposuction and 0 restrictions. Extended all the way up to the costal margin on both sides. We raise the whole thing up like you saw it. And then we wait 6 months for the blood vessels to regrow. And then we can do liposuction. Because if you do a combined procedure, number one, you're not doing an extended tummy tuck. And you're not doing an extended lipo either. It's a limited liposuction and a limited tummy tuck. And it gives very good results, and many doctors are doing it, but then you also have that higher risk of necrosis. So I never do that. I wait. So we do this extended tummy tuck. We took about 10 pounds and 3 ounces or something like that. 10 pounds and 3 ounces, that's a lot. And then we wait 6 months, and she can go on the weight loss medications, the injections. That's incredible. And then 6 months later, we can do high definition liposculpture, where we can draw her abdominal wall muscles. And we've done some incredible transformations in patients worse than these that had like huge amounts, and then you see them after the 6 months after the high definition, they look like a model, like an athlete with the lines and everything. It's incredible. And you've seen him, you can see him on Instagram if you like, but I prefer 2-stage procedures. So this is the first stage, extended abdominoplasty. She looks incredible, bloodless technique.